welcome to a new video. In this video, I'm gonna talk about the healthcare system in Sweden. So if you have just arrived in Sweden and if you haven't registered to a Vård Central, then just go ahead and do it as soon as possible, because a Vård Central is like a clinic. It's like the primary clinic. For example, if you are living in a certain area or municipality, let's say for example I live in Stockholm in Kista, so we have a Vård Central here. And similarly, like if you are living in a different part of Sweden or in Stockholm, there would be a Vård Central clinic that would be like handling the patient in that municipality. So like when you arrive here, so you need to, like, if you are sick, you just go to the Vård Central. You basically have to show your ID. If you don't have ID, you can show your passport. But the important thing to note is that you need to have a person number here. If you don't have a person number already, then you should have already applied it at Skatteverket. And that is like the first step that you should do as soon as you arrive in Sweden, to apply for a person number. Because if you don't have a person number, and if you go to a Vård Central for treatment, they would charge you around 2500 kroner, which is really very expensive, right guys? So otherwise, like when you go to a Vård Central, like you can book an appointment by calling them over the phone. And usually you have to call them really early at 8 o'clock in the morning. Otherwise, like most of the times are like filled. And like those times that they give in the morning are for emergency, and they call it akuten in Swedish. So if you want to get like a normal appointment, not an emergency one, you just have to basically call them during the day, and they will look at the schedule of the doctors, and then they will give you some kind of a time. Otherwise, like if you are in a urgent care, then just call them like in the morning and try to find a time. And sometimes it happens that you are not able to find a time. Then in that case, like there are this Närakuten clinic, which if I translate to English, that would mean that nearest emergency clinic. So I live in Kista. The nearest one for me is in Rinkeby. And if you don't get a time in Vård Central, you basically call them, or you can just go in there and drop in and basically sit there, and some doctor will attend to you. And one more thing to note here is that every time you visit Vård Central or like some Närakuten, you have to pay 200 kroner. But if you have already paid 1100 kroner during the last 1 year, then you will not need to pay anything more. So all the subsequent visits to the clinic or to the hospital would be free. So in short, you will not have to pay more than 1100 kroner in a calendar year. Actually, not in a calendar year. The year would start from the very first time that you had paid the 200 kroner. And the other thing is that, like, sometimes if you are like in a more emergency situation, and it's not something that these clinics or the Närakuten can handle, then you can actually go to the emergency or the acute department of like the bigger hospitals. For example, in Stockholm we have Karolinska Hospital, then we have Danderyd Sjukhus, and then St. Goran Sjukhus, and there are many more. So you basically go in there, and then it would be the same process there. You have to basically show your ID there, and then usually they charge 400 kroner. But if you have already paid 1100 kroner, then you don't need to pay anything more. And a nurse will come, and then the nurse will take your blood pressure and listen to your problem, and yeah, they will assess how urgent your problem is, and then you would be asked to sit in a waiting room, and then after some time there would be some doctor who would attend to you. And yeah, I forgot to tell about what's the process when you go to a Vård Central. So if you go to a Vård Central, you actually directly meet the doctor. You go to the reception and you show your ID and you'll be asked to wait, and then a doctor would come in there and yeah, fetch you, and then you can yeah, talk about your problems, and they would prescribe you some kind of a medicine if needed, and those medicines would be directly prescribed to your person number. Now, the second part, how to get the medicines. So if the doctors have already prescribed you some kind of a medicine, you go to the pharmacy, and the pharmacy here are called apothekes, and you have like plenty of apothekes, like almost like in all the shopping centers or all the areas, and you go in there, you show your ID there, and then they will see in their system that the doctor has prescribed you these medicines, and then yeah, they will fetch the medicines for you. You basically uh, pay and then get the medicine. Yeah, one more important thing to note here is that if you have already paid more than 2200 kroner in like the last 1 year from the first time you got the prescription medicine, then you don't have to pay anything more if you get like more medicines. But the important thing to note is that this is only for the prescription medicines, not for like the over-the-counter medicines that you get. For example, the paracetamol or the ibuprofen or like this cough syrup and those kind of lotions, those are like over-the-counter. Those are not counted towards this 2200 kroner yeah, amount. So all the medicines prescribed by the doctor, only those will be yeah, counted towards this. So in short, like I would say that the healthcare is pretty nicely subsidized, and like it's the same for everyone irrespective of the fact that if you are working or you are non-working, if you are rich or poor. And it is like taking care of like the high cost, because if you see in India, if someone is gonna suffer from cancer or some other very deadly disease, it costs so much amount of money that even people are like forced to like break all their savings or sell their land or like their apartment or something to fund the treatment. And that's really unfortunate there in India. But here, like even if someone is suffering for a very serious disease like cancer or something, it would be like treated kind of like free here. So I would say that the healthcare system is quite good, but it still has like a scope for improvement. And yeah, it's like an ongoing process, and some of the hospitals here are like really good, like the Karolinska and the Danjik QQ, they are like one of the best in the world. Besides going to the ward central or to the hospital, there is also one phone number that you can always call to get some medical advice. And if you are very unsure what to do, they can really help you. And the phone number is 1177, and it's a toll-free number, so it will not cost you anything if you dial from your mobile number. And beside that, there are some digital apps as well that you can use to get some advice from the doctors. One of them is doctor.se, and another one is kry.se. So you can basically you go to the Play Store or on the Apple Store, and you can try to search for these apps and download them on your phone. There is another one called mindoctor.se, and the main thing how these apps operate is that you can just go in there and log in with your mobile bank ID from your phone, and then they will schedule a time for you with a doctor, and the doctor would see you through the front camera of your phone, and you can describe your problems to the doctor. And if the doctor is really very sure about your problem, they can even prescribe you some kind of medicines as well, which you of course can get from the pharmacy, as you do in case when a normal ward central doctor prescribe you some medicine. And I would say like these apps are also quite useful if you don't have anything very serious and still need some kind of advice from doctor. And also if you are finding it hard to get a time at a ward central, then I would definitely recommend using these apps. Okay guys, I hope that you found this video really useful, and please subscribe to my channel, and you can follow me on Instagram, Facebook, and I will leave the link in the description below. I will be sharing more such useful videos with you in future. See you in the next video. Thank you.